Good evening, everyone. Welcome to tonight's webinar, Sparking Movement for People with CP, a Disability Tech Talk with Ray Browning of Biomotum. I'm Jocelyn Cohen, Vice President of Communications and Engagement with Cerebral Palsy Alliance Research Foundation, or CPARF for short. This event is closed caption enabled and I've turned on transcription. It's also being recorded and I'll send around a link once it's posted. For additional accessibility, I'll share a visual description of myself. I'm a white woman with dark brown chin-length hair that's down and I have brown eyes. I'm wearing large blue-green glasses and a dark blue and green plaid shirt. Sometimes I might look like my eyes are looking away from the screen or rolling, but that's part of my cerebral palsy. In case this is your first webinar with us, I'd like to tell you a bit about what CPARF does. Despite being the world's most common lifelong physical disability and affecting 18 million people around the world, cerebral palsy is still one of the most underfunded conditions. That's why CPARF funds research and innovations that will change what it's like to live with cerebral palsy. On that note, earlier this year, we launched a pilot cohort of Remarkable US, a disability tech startup accelerator. We work in partnership with Remarkable, a transformative Australia-based startup accelerator that was founded in 2016 and made possible by Cerebral Palsy Alliance, our friends in Australia. And through seed funding, mentorships, deep dives, and support during the accelerator program, we help startups bring life-changing technology one step closer to the people with disabilities who need it. This world isn't built for disabled people, but thankfully there are companies built for that purpose, and Remarkable US has already worked with them. These companies are built to fill in the gaps, meet crucial needs, and help people reach goals through access that they've never had before. Biomotum, a member of our pilot cohort, is one of those companies. They focus on optimizing mobility with intelligent, intuitive, wearable systems for people with cerebral palsy and other conditions. I'm thrilled that we have CEO and co-founder Ray Browning with us tonight to talk about Biomotum's work and how they can reshape what it's like for ambulatory people with CP to move. Ray co-founded Biomotum nearly 3.5 years ago. He earned his Bachelor of Science in Mechanical Engineering, his Master's in Kinesiology, and his PhD in Integrative Physiology. Welcome, Ray. Can you tell us a bit to start about the Biomotum Spark, the technology behind it, what inspired you to create it, and where it's currently being used?
Sure, Jocelyn. First of all, it's really, really great to be here. I'm honored and grateful to have the opportunity to speak with you and the attendees and tell you a little bit about what we're doing. Look forward. I see some familiar names in the participant list, which is great. And I look forward to having really a conversation with both you and the attendees around what we're working on. And hopefully what it does is it gives you an idea of where we see one part of the future for individuals with cerebral palsy that I think we'll be able to deliver, which is super exciting. Relative to your question, I think maybe a good way to start is I have a video that I can share with you that's about our founder story. So it's about Zach Lerner and myself and how this started. So if you don't mind, maybe I'll share that out and then we can dive into some questions.
Perfect. Go ahead.
Okay. All right. Thanks.
I think we got it. Yes.
It's really easy to be inspired and motivated to keep going when developing assistive technology. We work daily with individuals who will have their lives changed by the technology that we're developing. And so we're working as quickly as possible to make our products available to improve people's lives. Hi, my name is Zach Lerner. I'm a co-founder of Biomotum. We're a wearable rehabilitation robotics company. We're seeking to optimize mobility for everyone on the planet. And it's particularly geared for people that have difficulty walking, children and adults that have movement disorders that make it almost impossible to navigate around their community unassisted. I've been interested in physical activity and pushing the limits of human performance my entire life. And I've also been interested in robotics my entire life. So with Biomotum, it's an opportunity to join these two passions. What I think is really unique about our company is we're taking a holistic perspective to the treatment of movement disorders. So on one hand, we can use our wearable robots to augment mobility in the community to make walking easier and increase access. but we're also using the technology to improve function through targeted resistance training. And that combination, I think, is really powerful.
Zach and I have always been extremely interested in human movement and mobility, largely because for us personally, and we've seen it with lots of other people, the ability to move in the environment really unlocks human potential. We got a recent connection from a parent, and she said, "I saw your device online. I have a 20-year-old daughter who has cerebral palsy, and I would like her to be able to walk down the aisle in her wedding." And that's what we can do for people.
I think there's a huge potential for wearable robotics to really change the trajectory of movement disorders in individuals with disabilities and individuals that are seeking to change their physical activity performance.
We are going all in. We are going to be the global leader in personal wearable mobility solutions, not just for people that have impaired mobility, but for anyone who wants to thrive and live a physically fulfilling, active life.
Okay. So that tells you a little bit about us. Obviously, we were part of the Remarkable program, as Jocelyn mentioned, which is a fantastic program for all of you future innovators out there and entrepreneurs. I would strongly encourage you to create new, interesting solutions to the challenges that you face, and use the Remarkable program and supported by CPARC to help you do that. So hopefully that gave you a little bit of an overview of what we were trying to do. I'm going to give Zach really the credit for the invention of the device. And I say that as a proud, Zach was a PhD student in our lab, so as a proud mentor of him. So, really quickly, the device, if you're familiar with, which many of you are, sort of electric bicycles or other e-assist kinds of products, the device is a wearable robot, which works a lot like that, which means that as you push down on the ground, in assistance mode, the device will actually help move your foot in that way. Think of it like a gas pedal. Harder you push, the more assistance that you get. There's also a way, what we can do is have that same pushing down do the opposite, which actually makes it more difficult. So as you walk and you're pushing down, the device is pushing against you. And that's what we call resistor restore mode. And that's something that you can use to functionally strengthen muscles while you walk. So the device kind of has these two modes, both of which operate in the same way, but we change the direction of the assistance and make it resistance in one mode. So that hopefully gives you a little bit of an understanding of, all the bells and whistles that are in there. So.
I mean, I've heard a bit about the device before, and it's just something that's really exciting to me as someone with CP who, ends up standing on my toes a lot. It seems like it could really help with that and potentially activate muscles that I wouldn't ordinarily have access to. Is that accurate? Like, it kind of gives the user, it uses muscles that perhaps like your brain can't otherwise reach, or activates muscles that your brain can't otherwise reach with a CP, brain injury, or some other injury?
That's true, Jocelyn. I think the way that we think about it is there's really two kind of levels of impairment that we're trying to address with technology like this. One is oftentimes individuals would have been placed in, for example, an ankle foot orthoses, a rigid ankle brace for a long period of time, many times years. And while those help sort of with just basic getting around and not being in, for example, as much of a crouch, they tend to leave the ankle muscles really weak. And so one of the things that we're trying to do is overcome that inherent weakness in those ankle muscles, either by sort of providing extra muscles, or in the resist to restore mode, really providing an opportunity to strengthen those muscles. The second thing, so the actual physical characteristics of the muscle is one thing we hope to be able to change. The second thing, though, is what you're speaking to in regards to the information from the brain.
Mm-hmm.
to the muscle itself. So the motor programs can be either immature, poorly organized. And so what's happening is the signals to turn on the muscles are not happening necessarily at the right time. So we're also facilitating that motor control and improving, we think, some of the motor control. And we measure that by how active the muscles are and when they're active in walking. And we see some changes in those activity patterns as they use the device. So really it's kind of, it's both of those things.
Okay, that's really helpful. I know that throughout my work here over the last almost 4 years, I thought I knew a lot about cerebral palsy and the way that I walk and the way that other people might walk around. Turns out there was a lot I had left to learn, and speaking with you tonight and at other times I keep learning a lot more about that. Just going a little bit back to the device itself, do you know what inspired Zach specifically to create it, other than potentially having you as a mentor, and also where
Well,
it's currently being used?
That was not it. So as Zach mentioned, I had the pleasure of having him in our laboratory, the most talented and motivated biomedical engineer I had ever had the pleasure of working with. And as he mentioned, he was always tinkering in the lab he built artificial muscles that were running off of air. He would build the device to help people detect some trip functions, had a little sensor in the front of the shoe. So if you came across an object that would reduce tripping. So he was very interested in improving mobility, whether it was reducing the risk of tripping or if somebody needed artificial muscles. And that really just, I think, at the same time, two other things were happening. There was a lot of advancement, and there still is, in robotics in general. So, the things that read the self-driving cars and other even industrial robots that do things like warehousing. So lots of work in robotics. Lots of work in electrification of transport, so electric cars, vehicles. So what that happened was you take this interest and then you combine these rapid advancements in how to make wearable robots combined with relatively inexpensive parts for those wearable robots. And you start to see, ooh, maybe this is feasible to actually make something that would be able to be commercialized and used around the world. To answer your question about where the device is being used, we have research partners that are currently engaged in research projects at University of Washington, University of Arizona, Northern Arizona University, University of Helsinki, Shirley Ryan, Ability Lab in Chicago, and Gillette Children's Specialty Care in Minneapolis.
Mm-hmm.
We're about to deliver a device to the University of North Carolina, to Jason Franz's lab there. And then another one that's slated is to APRC, which is a facility in Mexico City, which works with children with cerebral palsy. So those are kind of where people can find the device right now. And we're constantly working to get devices to research environments so that researchers. So if people can certainly reach out to me, and if I can point them in the right direction, if they're interested, is there a place near me that might be doing clinical trials with the device, certainly can try to facilitate that connection too. So.
Okay.
Yeah.
Thank you for that. I'm sure that whether they're watching now or potentially watching on YouTube, they would love to be connected. So
happy to do it.
I already have some questions in the Q&A. I'm going to go ahead and ask. Susan asks, do you find that it decreases spasticity over time? And this kind of goes a little bit to what you were saying, are you going to be testing quantifiable movement synergies to show permanent change with growth in children with CP, not adults, she says.
That sounds like a Susan question. I'm going to see Susan next week, I believe. We're going to finally connect. Susan, by the way, to tell you the kind of the caliber of the audience, is probably one of the global leaders in spinal neuromodulation for treatment of cerebral palsy. So just delighted to have her on this another topic for another conversation that I hope she'd be a great speaker, by the way. So to answer that question, we do see reductions in spasticity both acutely and over time, and we have some fairly standard outcome measures to measure muscle synergies. That's one of the ways that we're measuring the motor control approaches. So we measure the muscle electrical activation. And I won't go into the details about how we do that, but we are focused both on, in our research, both on what I would call clinically relevant measures like walking speed, 6-minute walk test, and other measures that clinicians would want to see their patients achieve. And then also there's a whole host of other outcomes that we're quantifying that are typically seen more in research publications. So not necessarily something that you would have a measurement of in a clinical environment, but that where you would be able to, as Susan mentioned, kind of quantify the changes, for example, in how synchronized these muscle contractions are compared to, for example, a neurotypical individual.
Okay.
Yeah.
That's helpful for me in some respects, and probably many more for Susan and people who study the technology that she's studying. Someone, Olivia asks if there are any plans on releasing this for personal use, which I understand
There are.
why she would ask that question for sure.
Of course, and I will start by saying we are working as hard and as fast as we can. The ultimate goal is to absolutely deliver this technology into the hands of individuals at home. There's as you can imagine, there's a pathway for that. This is a regulated medical device. And so we're in the process now first of doing research on using the device. A lot of our work is right now with children and adolescents with cerebral palsy, and using the device in a rehabilitation environment. So with a trained physical therapist,
Okay.
not a research center, but that would be sort of clinical relevance. And then the next piece of information that we need to gather for the FDA is to say, oh, and the device can also be useful at home, both to do therapy as well as to have assistance in daily living. That's data we're collecting now. But it takes a little while. So I would say in a couple of years, we'll have a device that would be cleared for personal use. But it's going to take a little while to get all of those I's dotted and T's crossed and the regulatory pieces.
Sure, but knowing how long things can take, I appreciate that 2 years in the scheme of things, it feels long, but it goes by pretty quickly. I mean, we're already at the end of this year, and I'm pretty sure it just started. So 2 years fly by. I'm part of the CP community, and I'm guessing that Olivia is part of the CP community. How important has user feedback from people with CP been during the Sparks development, and what role does it play as you further develop the device?
Great question. I'll maybe divide it into two groups. Okay. So there's the Susan Hastings of the world, and I happen to be married to, and Zach happens to be married to physical therapists who treat individuals with neuromuscular conditions like cerebral palsy. So one of the groups that we've gotten a lot of feedback from is the actual physical therapists treating patients using the device. And that's really important because if it's not easy for them to use, if they can't get it on a patient or a participant quickly and get it up and running, we know that there's plenty of technology out there that doesn't get adopted because it just takes too long. When you go in to see your physical therapist, they have 45 minutes to maybe an hour and a half if they're lucky to work with patients. So that's part one. So getting a lot of feedback from the rehab community in terms of how this thing has to function in that environment. Mm-hmm. And the second piece is we work a lot. We've had about 85, 90 participants using our technology. So these are individuals with cerebral palsy for the most part. And we have done specific usability studies. So how well does the device work? What can be improved? Those are always ongoing. And then we've done, in all of those studies, we've gotten feedback from the individuals in regards to what worked, what doesn't work, what feels good, what doesn't feel good. So that's a continuing evolution in the product in terms of being able to really serve the needs of the community. So and that will continue to be instrumental in terms of how we move forward.
That's really important, I know, because CP is such a diverse, heterogeneous disability that I have spastic diplegia and I'm ambulatory, and my friends that have the same diagnosis and are ambulatory have different experiences, and different muscles wear out at different speeds, and everyone has different needs. And so if someone like me was using the device and said, oh, this resistance in resistance mode, it really helps me when I do this, and they described their CP and it was like mine, I would definitely try that. Because we're always on the hunt as adults with CP, at least, for information. Of course, parents of children with CP are always on the hunt for information. It's new to them. And then like, as you age, you have different questions and different issues to confront. And to know that there's a good open feedback loop out there with people with all kinds of CP walking around and experiencing this. It's really a positive thing. Deb has a question on the clinical side of things. What degree of deformity does the exoskeleton tolerate? So my guess is like either the internal rotation of a foot, the shape of a foot, or other differences in the CP experience. Yeah,
and I'll answer that in what it does now and what we plan to have it do in the future. Okay. And so the device right now, the foot plate it's a carbon fiber foot plate that's relatively flat. So in terms of tolerating a lot of pronation or supination or out of plane structural alignment of the foot, there are improvements we can make there. The main limit, however, it doesn't prevent somebody from using it. In fact, we've had individuals put an orthoses on top of the carbon foot plate that really can accommodate that. Our plan in the future is to move towards an easily customizable foot plate. So the foot plate could then be fabricated to actually meet the specific needs of the individual. That's a request that we've gotten frequently. And then in terms of, there's also other transverse plane alignment where you've got internal and external rotation. We haven't seen, I wouldn't say there's an exclusion criteria for that. But clearly the more severe the, in particular, internal rotation is, that tends to maybe not be ideal for those individuals. But I think it highlights the fact that we're still learning every time we get the device onto an individual, learning what's working and what's not working. And then the other piece is, well, no, I'll stop there. Yeah, that's
okay.
Yeah.
I like the idea of the custom foot plate, because I'm just remembering back to those hard orthoses that you were talking about before of my childhood, and the calluses on my toes, and just how red and uncomfortable my feet felt, even if they were aligning things as they quote unquote should be. So I'm glad to hear that that's the next innovation on top of the innovations you've already made. And then Deb had a quick follow up, which was if there are size limits, and what's the youngest child you've treated? Or not treated, but had in your clinic, I guess, with this.
5. So 5 years old is the youngest so far. There is a desire, I think, shared across the company and across the clinical community to miniaturize, to allow younger children. I think that's a really interesting opportunity that we're looking forward to tackling. But we're also really cognizant of the types of therapy that are engaged in those young ages is less about, walking per se, and more about play and being able to move. And so I want to be careful that we don't, make the expectation shouldn't be that a device, it should facilitate the current therapies that are being done in the clinic, not sort of force 3 or 4 year olds into walking, over ground for periods of time, I think. So cognizant of the challenges, but 5 years old, the device is up to 85 years old. And in terms of weight, there's not really a lower limit, because it's really, the device waist pack would probably feel a little bit heavier on a lighter child. So there's that piece of it. But in terms of a weight limit for torque production, we can scale it down to weight. So as weight goes down, the torque production goes down. The upper limit is probably 200-ish pounds, 100 kilos, maybe 95 kilos, for those of you that are in the metric system. It's easy to, well, Zach would kill me for saying this. It's relatively straightforward to use larger motors to have higher torque output for larger individuals.
So like maybe the pack on the back would be different.
Slightly different.
In that case.
Yep.
Okay. And I really appreciate you also sort of, I don't know that protecting is the right word, but I'll say protecting kids and their ability to have a play experience when they're younger, because you can also, incorporate play into physical therapy, which is super important for kids. Because if you're doing it 2 to 3 times a week or even once a week, it's a lot. So I appreciate that.
Yeah, I think one of the things that's important for us is that we hope that we've built a helpful tool for the community. We think that there's a lot of potential value for sure, but it needs to be used by people who are familiar with how to use, I don't want to make it sound like you have to be specially trained. That's not what I'm saying. What I'm saying is that we're going to learn a great deal about how this technology is most useful by individuals using it. And rather than saying, yep, do this and do this and do this and do this, and that's the path to success, that's not really how we think about it. We think about it as, this is a flexible platform that should be valuable to really improving mobility in individuals, whether it's through assistance, whether it's through rehab. We're less focused on any particular outcome of that in terms of just really, getting it in the hands of individuals who can help us better determine how this technology can be used. And when you have a smart device like this, one of the cool things that we don't really talk about too much, but I'm excited about, is if your therapist or you use the device and find a way that it's been remarkably effective for you, there's quantitative information that could be shared with other individuals who would maybe have access to the same technology. And that traditionally hasn't been the case, because you've got therapists working in isolation over here, and they come together at conferences and they talk about it. We know it takes a long time for standard of care to change in medicine. So we're also hopeful that these kinds of smarter technologies shorten that period of time between the time that you try something and the time that it actually becomes more broadly used. So that's another thing that we really hope for.
Yeah, that's really exciting to me as well. Okay, I have a few somewhat related questions. So Michael is asking, what differentiates Biomotum technology from other mobility rehab or training devices? Are there other technologies that this could work in conjunction with? And then kind of piggybacking off of that, Olivia asked how this compares to something like Rewalk, which has to be used with crutches. So I know there's lots of different types of devices. So it's about how they could interact with this, how this compares with that.
Yeah. Hold on.
You okay? Okay.
Okay, got it out. Whew. Okay.
Glad you're okay.
Yep. So I'll talk a little bit about there are a few devices, wearable robotic devices, that are being targeted to, in particular, this condition, cerebral palsy and pediatrics. So Trexo makes a device which is sort of a walker that moves the legs. And there are a couple of other European companies that are working on that. Those tend to be for more severely impaired individuals. So these are individuals who probably would be unable to ambulate at all without the support of the structure. A little bit like a rewalk exoskeleton, which is designed really primarily for paralyzed or people who really can't walk on their own very well. And so I think one of the things that we're focused on, or the way that we're thinking about this initially, is we know the ankle joint is important. We know that a lot of people have dysfunction around the ankle joint, but they're not unable to walk. They're able to walk, but they would like to walk better. And that's really what this is targeted to. Rewalk does make an ankle device. It's for stroke. It's a single limb device. It would not, I don't think, be very suitable in particular for younger. It's heavy. It's quite heavy.
Okay.
And kudos to them for building something for stroke. Awesome. But I think we're taking a light and simple approach to the field in terms of a complementary intervention. So I think Susan Hastings and the SpineX team probably have, to me, some of the most exciting sort of combination, which is, can we combine spinal neuromodulation with devices like this? And Susan and I have been talking about this for a few years now, so we're super excited to get together and chat more deeply. But I do feel like there is a strong likelihood that my hypothesis would be that would be a 1 + 1 = 3 the type of scenario. And then, in terms of how it could be used with other existing treatments, I think that really just remains to be seen. We don't have a lot of data on, combining it with other devices, for example, other, whether it's body weight assisted treadmill training. People have been asking us about using it for even standing in children that have, inability to walk but need to stand for health reasons.
Right.
So a lot of use cases out there that we haven't explored yet.
Right, and that sort of covers the idea that for this device, it's for people who are ambulatory, but you don't necessarily need to be independent of a mobility aid to use this. So
that's right. So you can use a walker, you can use a crutches, for sure.
And one of the things that I think it would probably help with is that it would seem to lessen physical energy consumption for people with CP, because if it's in assistance mode, right, it's assisting you. So then between the mental and physical energy is probably going to lessen the energy consumption. Do you have some data on that? Because people with CP use up to 5 times the energy of people without CP to move around. And can you share how it's possible, sort of beyond what I alluded to, and how much the energy use is reduced?
I can. And that was really one of the early goals of the technology, was can we make a wearable robotic system that actually reduces the cost of walking? It's a fairly significant challenge, because when you add weight, in particular to people's legs, it makes it even more expensive, not less expensive. So how do you do that in a way that our data suggests that we can reduce the energy costs by anywhere from 20 to 40% on average, depending on the specifics of the condition, using the device in assistance mode. And there's several papers that I can point them to that describe those findings. So from a physiological point of view, using the device in assistance mode clearly has physiological benefit. It reduces the high energy costs associated with walking. Here's what's interesting, though. Children tend, our experience, at least so far, is that what they do with that is not, that's easier. They actually just go faster.
I love it.
Which is fantastic, right? I mean, they're just like, they're kind of used to the effort, right? So the effort isn't really the thing that they're not, I haven't met an 8-year-old who is really complaining. I mean, they say that they'll get tired, but giving them a little bit of a little more gas in the gas tank.
Yeah.
So what they do is they'll say, "Oh, I'll just walk faster," and that is a pretty interesting outcome. In regards to, it's a really good question around cognitive load and cognitive fatigue or mental fatigue. I can't say that it's a specific question that we've really sought out to quantitatively answer, but I would say kind of qualitatively, there's a reduced cognitive load, right? That they're not having to work as hard to walk, really.
Right.
I mean, I mean that not just physically, but also mentally as well.
It's a real, it took me until about 3 years ago to really understand that mental energy is physical energy. When I was at the AACPDM conference, physical therapists said that to me. It was a light bulb moment, because I'm using mental energy to just think about my movement, pick up my foot, etc. But then if I'm also on a sidewalk in New York City, I'm dodging barricades on the sidewalk and cracks on the sidewalk. I'm looking up and down and around. And if people have bags that they're carrying low, that's like jousting me, essentially. Someone could be walking with a dog that their leash goes around me. So I'm always paying attention to that. Then there's tourists that back up, there's trucks blocking things. And so the mental energy to move plus the mental energy to not collide into something plus the physical energy to move. I love the idea that even if it's only technically affecting my physical energy, I would then still have some extra energy to think about what's around me instantaneously, like I have to anyway. So I love to hear that at the very least that it's lessening the physical energy load.
Yeah, and I think it's really important to recognize that for those of us who can drive a motor vehicle, we jump in and we don't necessarily think about the fact that it took us a long time to sort of kind of get comfortable in that environment, understand what the car is going to do and what all the pedals and knobs and things do. And the same thing is true with any sort of new technology. So I think what we know now in regards to how individuals respond to using this technology is the beginning of a journey that, how will somebody decide to use this 2 years after having it? And I'm really fascinated by that because I've watched in the demonstrations that we do for folks, there's a very big difference within about 7 to 10 minutes of just walking continuously where people start to experiment a little bit. First, they're not quite sure what to do. It's like, okay, well, I'm just going to walk. And then it's long steps and short steps and speeding up and slowing down and changing directions and doing a lot of different things. So really trying to feel out, what is the device? What's my relationship with the device? And I think that's really interesting to me because we're not going in with any preconceived notion that walking should look like X, right? It's really more, well, if you have a little bit of, augmentation to your musculature, how are you going to decide to move in a way that best suits you? People might walk just like everybody else, but I always tell the story that NASA early on in the Apollo program spent a huge amount of time and research around the world trying to really quantify the effects of reduced gravity on walking energy expenditure because they had to give people oxygen tanks and they were going to walk around on the moon.
Yeah.
And you'll see where I'm going in a minute. So they did all of that and they put the tanks on. Of course, Neil Armstrong, I think whoever hops out, literally hops out and then skips across the surface of the moon. No, nobody studied skipping, but we have this innate ability, I think, whether we have a neurotypical or neurochallenged, a neuromuscular system to self-optimize. And I think I'm curious to see within limits. I mean, you can't let it go wild, but I think we're going to see movement strategies evolve with augmentative systems that maybe will surprise us a little bit. And we should be okay with that, right? We should be all right with that kind of, you might find that using the device that your stop-go strategy is different than what you would use without it.
Yeah, the
So I
amount
think
of
that's
space I have to leave for myself between me and another person.
yeah, and maybe it's a couple of short stutters, or maybe it's a pivot. Maybe it's, I don't know that we know. I'm really excited about that, because that's like, wow, all right. How are individuals going to solve the problems that they encounter in the community when they have something that they're using that maybe they haven't had before? So that'll be really fun.
Yeah, and we're a group of people that really we have to adapt to our environment because it won't necessarily adapt to us. And at least in my experience and some of the experiences of people my age, we're used to kind of like losing a little bit of our ability and having to adapt around that. And this could potentially give us back some of the freedom and maybe trust that we had in our movement beforehand. And that's a priceless thing. And so I look forward to this getting into the hands of people that want it. There are a bunch of questions in the Q&A, and I want to make sure that we can get to them because we have about 12 minutes.
Sure, of course.
Kay asked, what UNC campus are you working with? Because they're willing to be a subject for people beyond adolescence.
Great, Kay. I'll have you, if my contact information will be in here, reach out to me. It's Jason Franz, who's at Chapel Hill. So that's the campus. He's in the biomedical engineering department, but I can connect you.
Okay.
Sure.
I know Kay, so I will put you two together on an email.
Okay, sure. Yeah, that'd be great. Yep.
And then Deb asked what the cost is, but do you even know, because it's in this regulatory space, and is the cost different or projected to be different for a big clinic versus a smaller clinic versus an individual who's affected, or you could also say you're not comfortable answering that question at this time.
No, I mean, I'm happy to try to answer the question because people want to know that, right? They deserve to know. I mean, are they staring down the face of $100,000 piece of equipment? And the answer to that is an emphatic no.
Fantastic.
We started out by fundamentally believing that what the world didn't need was another really expensive piece of technology that was going to be hard to be covered by insurance and would leave people wanting but not able to use the technology. Right. And so our goal, is that we would like to be able to deliver this device at about the same price as bilateral AFOs, custom AFOs, which really makes it a very easy insurance justification case because we think we offer a far better solution for mobility than two AFOs. So that's $2,000 to $3,000 depending on the level of customization. That's a longer term price point. I mean, initially it'll be more expensive than that, probably not more than $5,000 to $10,000, depending on how early people are.
Okay.
That's our targets, is to sort of start maybe there and work our way down. Although there are a lot of things that can influence that, mostly positively. Motors, drivers, the components of these kinds of technologies continue to be cheaper.
Right.
Just because of their broad utilization. So we would like to be able to capitalize on that. But I feel like we have failed if what we bring to market is yet another really interesting, useful piece of technology that cannot get in the hands of the people that need it. That would not be success.
I'd say I appreciate that. I've said that a lot today, but I really do. Because there's nothing like seeing something that could potentially help you, and then you're like, there's a lot of zeros in that number, and I could never get my hands on it. And if, this could also help people that are in potentially more under-resourced places that don't have access, that are farther away from other medical care. Obviously, you need physical therapy training within the device to be safe and understand, at least at the beginning. It doesn't seem like something that you could just put on yourself and get going. I mean, if you're me, you'd want to try it out with your PT around you. Maybe I'm a more cautious person. Maybe there are people that are less cautious, but it feels like it could help people in that situation too, of being under-resourced. Speaking of physical therapists, someone asked if a practice could get a unit and or be part of a local trial. And I'm happy to find that person's email address after this and connect you if you're okay with that.
Yeah, we're in the process of spinning up and organizing some usability trials, and so looking for partners to help us do that is really is part of that strategy. So I see that's Johnny. So just have Johnny. We'll connect. If you can connect us, that would be great.
Sure.
We can. I can't promise anything right now, but that's certainly
But
a
at least
work in progress. Just to have
information at
usability
least.
trials.
Yep.
For sure.
Okay.
Yeah.
And he also asked if the device is assisting or correcting you. And I got the sense that it's assistive more so than trying to, change the way your foot's rotated or the way that it's positioned, that it's really helping with, like, your load and your balance and the amount of energy that you're using.
That's correct. I think the correction comes from working with a rehabilitation professional. So that feels like that's not what we're trying to make, is that you should walk in a certain way. That what we're trying to do is to say this device can facilitate mobility, but you want to be working with somebody who understands you and what your specific requirements for the device are. So,
right.
We're not prescriptive in that way. You need to walk like this.
That's a really freeing statement, because at least people of my generation, that's not the language that was used. So, it's great in the formative years for young children and adolescents to have this and really grow up with this as an option. And it's a way for people like me to reprogram a little bit the way that we think about how we have to move, like what's right and what's wrong, and what will get us. It's really about like what will get us safely from A to B without us hurting ourselves and using too much energy in the process. Just one note, I see a bunch of people are interested in being connected with Ray, and I'm making sure to take your names down, and we'll connect you all separately via email.
Sure.
Olivia had a great question that I would have this question as someone who keeps track of this for myself. Have you studied how it affects falls, and does it significantly reduce falling?
As
Everyone
you guys are,
wants to know.
yeah. We have not specifically studied fall incidence in individuals with cerebral palsy. However, there's an inverse relationship between stability and walking speed, which means as you walk faster, stability actually improves, doesn't get worse. So there's a hypothesis you could make that it should reduce falls, and there's a lot more to that. I will say though that, and this kind of speaks more broadly beyond cerebral palsy, we're working with older adults now to determine the effectiveness of the device in reducing fall risk in frail older adults. And that's a really significant challenge for that population. So we're putting some energy into that. I suspect that we'll see a reduction in falls. People will be, individuals with cerebral palsy should certainly be stronger. The device can serve as a little bit of a fall detection and fall I hesitate to use prevention, but at least maybe can catch a step, for example, that would maybe have led to a fall without the device, but the device might be able to accommodate that. We haven't really programmed it to do that, but
yeah, I mean, if it's helping you kind of clear the ground a little bit more, I know that at least my falls are because one of my feet drags and catches either something or nothing, but it drags. And so my non-scientific mind is like, well, if it's going to pick my foot up a little bit more, I'm going to be less, it's not going to stop me from falling. That is not, I don't think that will ever go away, but that will help. And then also the idea that it is conserving my energy, because like I said, I actually keep track of my falls to monitor patterns, and they almost always happen when I'm tired. So if I'm conserving like a third more energy, then I'm some amount less tired. So therefore some amount less likely to fall. Probably still will fall. It would be magical if I did not. But I will end with Katie's question, although we had two other ones, which is, do you envision people using this more for certain activities like hiking or more for people to go out and about on their day? And is it a personal preference?
Well, for Katie, it's going to be for hiking. I mean, it's Katie, for Christ's heaven's sake. I mean, she's going to use it to do all kinds of wild activities. I think it's really personal preference. I think that what we hope is that people use it to strengthen and get stronger, which would in some cases allow them to not need the device to do hiking. In other cases, they'll find activities that the device is really ideal for. Hiking is an obvious one, or just, if you're going to the zoo and you're going to be walking for a while and you want to be able to explore some of the things that maybe aren't as accessible, or you're going to a place where accessibility is less than ideal. I can see, that being a key environment. I think ultimately this is about just life experiences. It's about just, can we move the needle a little bit and offer some life experiences that people want to have that maybe they're not quite able to have. That would be really remarkable if we could help deliver that. I think that would be. But before I'm gonna get Marie's question. I see
Okay,
it.
go
Yes,
for it.
on other joints. Sort of thinking about that. It's early days, but there's nothing that tells us that we can't do it. And then Michael's question, which is a great one. This is really more of a question about maybe entrepreneurship, is what advice for other people trying to do this. And my simple response to that is, this is one of working with individuals with these variety of conditions is some of the most interesting, thoughtful, and helpful people I've ever been around. And so if you want to make a difference, get in, live their life with them, understand what they go through each day, and then work hand in hand with them. Don't bring them a solution to a problem that they may or may not have. Start with the relationship, build it, and you'll learn so much. This has been such an eye-opening experience for me personally. I mean, I'm grateful, and I am in awe of the individuals that I see. So.
Right. You're almost bringing me to tears, because one of the things that we really seek as people with disabilities are allies, and you're living that in what you're doing with what you just said. And I kind of want to let you have the last word on that, because you said it so beautifully, and I know that it will resonate quite deeply with any person with a disability who is watching this right now or who sees it later on. The amount of true allies that understand as best you can, because we're all in our own bodies and you're in your own body, but as best you can, the disabled experience without having the disabled experience, and really centering the experience and the life of the person you're trying to help. That is a monumental thing. And I just want to thank you for that. And thank you for your time, and thank everyone as well.
I've had the pleasure of doing a lot of different things in my life, but this is by far the most impactful work that I've been honored to be a part of. So we're all, it's, and I say that this is a really fun job. I mean, it really is. I mean, I don't want to make it sound too, I am part of a group that's making wearable robots to help people, experience things that they may never have thought was possible. Oh my gosh. I mean, end of story. Great, done. I can walk out stage right at the end of this and be completely happy that, we've tried to make a difference. So super grateful for the opportunity today to speak with you, Jocelyn. I really look forward. Hopefully we'll get a chance to see each other in New York in a couple of weeks. Which
Yeah, I
really
hope
enjoy.
so. It's always great speaking with you. I'm so glad that so many people attended and were so engaged and asked questions that illuminated different answers for people who might not have thought of asking those. And as I mentioned, this will go up on YouTube likely within the next week, and I'll send a link around to everyone who attended so they can rewatch and send it around to other people who might appreciate it. Thank you everyone again for your time, and especially thank you, Ray. I will talk to you soon, I'm sure.
Okay,
Have a good
bye
night.
everybody. Thank you again.
Bye.
Bye.